Good afternoon. Welcome to the City of Memphis and Shelby County Joint Task Force Media Briefing. My name is David Sweat. I'm Deputy Director with the Shelby County Health Department, and I'm the person in charge of the COVID response unit at Shelby County Health Department. I want to give you a few updates today regarding our statistics and numbers. We are this afternoon at 26,903 reported cases. We've also had 370 deaths reported in Shelby County, which represents 1.4% of the cases who've been diagnosed have been fatal. Our median age of death is 73, and the range is 13 years to 100 years old. The number of cases increased from yesterday by 247 cases, and so that does represent a higher number than we've been experiencing in most recent days, and that's twice this week that we've had more than 200 cases reported on a given day. In terms of we've had some questions from the public and officials and others about our progress against the various indicators for improvement versus setbacks that were laid out in Health Directive number 11. And I want to give you a brief update on that. As far as opening up new businesses or releasing some of the restrictions that have been placed on businesses, there were 8 indicators laid out in the Health Directive number 11. We have only met 2 of the necessary indicators, so we still have a way to go. The 2 indicators that have been met is we've had an improving trend for 2 weeks in terms of the number of cases reported. So we've met that indicator, and we're averaging right now less than 180 new cases per day. So we've met that indicator, but the remaining 6 indicators that were laid out are failing. So our positivity rate is still too high, and we are not experiencing the 30% declines week to week in terms of number of new cases reported, et cetera. So we will continue to monitor that and update people on progress against those improvement indicators on a weekly basis. In terms of the statistics, we have some slides to share today. This is a breakdown of our cases by age that have been reported as of August 26th, which is yesterday. And what I would call your attention to is that 80% of the cases that have been diagnosed in Shelby County are less than 55 years of age. So we do see, in fact, half of the cases would be less than 44 years old, or less than 45 years old. So we do see that the younger age groups are where the epidemic is most active in terms of its transmission and in terms of the number of cases diagnosed. Next slide, please. When we look at our distribution by race and ethnicity, we have represented 58.9 or almost 59% of cases are Black or African American citizens. About 20% of the cases have been diagnosed among our Caucasian or white citizens, and the 21.5% is all others combined. In terms of our ethnicity, about 21% of the cases are ethnically Latinx, but 80% of cases are not. And that's for cases reported overall. And the next slide, please. When we look specifically at our pediatric cases, we're at over 9% of the total number of cases have been less than 18 years of age. And the disproportionate share of those born by our minority populations, 53% of the children have been Black or African American, and another 31% have been other than white. And as far as ethnicity, 31% of the pediatric cases are ethnically Latinx, and the rest are not. That is a disproportionate overrepresentation for children who are Latino. And next slide, please. So as I mentioned before, 80% of the cases have been less than 55 years of age at diagnosis, but 88% of our deaths have occurred in people 55 years of age and older. So as has been the message throughout the epidemic, we need everyone working together to protect those at increased risk. And right now, being 55 years of age or greater is an increased risk of death from COVID-19 disease in Shelby County. And so we do continue to need everyone to stay the course with hand washing frequently, use of hand sanitizer, disinfecting surfaces, social distancing, wearing a mask whenever in public, and avoiding large gatherings, even 10 or greater people, we would say is to be discouraged whenever possible. So practice the social distancing, wear the mask, practice good hand hygiene and respiratory etiquette, and protect yourselves and the people that you love. Thank you. And with that, I'm going to turn it over to our local health officer, Dr. Bruce Randolph.
Thank you, Mr. Sweat. Greetings, fellow citizens of Shelby County. I just want to spend a moment to just first encourage you to continue with your efforts to be compliant with the safety measures that we've outlined. We're making progress. There's a downward trend. We have not reached yet all of the criteria for improvement for us to open up some businesses that are closed, but we're headed there. Very crucial time is really the next couple of weeks. We've experienced reopening of schools. We've experienced the playing of sports, particular contact sports, football, and we have the Labor Day weekend approaching. So we'll be monitoring certainly data to see what are the effects of these changes. And our hope is that we'll continue to experience this downward trend in all of the criteria that we have laid out for improvement, so that we can open up things even more than what they are. As you may be aware, that we issued the Health Directive number 11, was effective August 24th, 2020, and I've received some questions about it. One question has been related to the mask directive that's incorporated in this directive. And if you've noticed that we're pretty much requiring everyone who can to wear a mask or face covering if you're older than age 2. And one of the reasons why we have decided that even children should wear face covering is because recent evidence has shown that even children can transmit the coronavirus at rates just as high as adults. And if we're to return back to school and protect our teachers and staff, we need to have students of all ages as possible to wear face covering. Speaking of schools, there's also, you notice in the Health Directive, and Mayor Harris has already addressed this, the requirement for schools to work with the health department to help us identify when a student is, our staff or teacher tests positive, so that we can identify those who may be at risk, notify them, and place those who need to be placed in isolation, and those who need to be in quarantine. Similar thing will apply to sports. As you're aware, I may have heard that there have been an incident where a player who participated in the game subsequently, a few days later, tested positive. Well, the health department is involved in that process. We're investigating and we're seeing who all would have been exposed, and if indeed they are close contacts, will be placed in quarantine for 14 days. There's also some recent information about limited services restaurants. I won't go into great detail about that because of some pending litigation. I would only say that any establishment that becomes a full-service restaurant and meet the criteria of a full-service restaurant, we will honor that and expect them to abide by the safety measures outlined in the health directive for full-service restaurants. With that, I will end and allow time for questions that you may have.
Jane Roberts, Daily Memphian.
Dr. Randolph, regarding the football and close contact, could you help us understand what would be helpful protocols for testing and what the health department may be recommending?
Well, our position has always been and still is that contact sports, such as football, is not recommended at this time. We still believe that it is a high-risk activity and the transmission of the virus can occur. However, we know that football and other contact sports are permitted because of the governor's executive orders, and so therefore schools are permitted to engage in contact sports. That's a decision that each school, each entity will have to decide. If you make that decision to engage in the sport and activity, close contact, such as football, first I would encourage you to adhere to the safety measures outlined in the health directive. Make sure that people are practicing safe distancing whenever possible, as much as possible. When feasible and appropriate, that they're wearing the facial covering and practicing good hand hygiene, etc. Now, the issue of testing, of course, the professional sports have the resources of testing their players on a regular basis, weekly, twice weekly, what have you. Some of the colleges may also have those type of resources. I doubt that high school will have that level of resources to be able to test. And testing simply tells us that at this moment, the person is not infected. When it comes to high school, even college, you're dealing with a population that already has the higher percentage of cases, and therefore a population that tends to gather, it tends to engage in activities that put them at risk of transmission or getting infected. And so you are dealing with a population that are likely to have positive cases in general.
Jane, did you have a follow-up? Daniel Connolly, Commercial Appeal.
Yes, hello. Did Jane have a follow-up? I didn't want to cut her off. It sounded like she might have.
Thank you,
Go
Dan.
ahead.
Dr. Randolph, can you say why the population would have a higher chance of being positive?
Just simply because of the behavior. So when we look at our data, we see that the percentage of cases is highest among those aged 18 to 44. And so when you look at just the tendency of kids, young people, et cetera, gathering, one not necessarily viewing this infection as a risk like older people because they're not experiencing all of the negative consequences. Our death rate certainly is lower among young people than older, et cetera. So that's one of the reasons why there's that risk. The other thing is that because our children has been at home for a considerable period of time and therefore have sort of been sheltered, we really don't know what the transmission rate's going to look like once schools have resumed, once they have started gathering, meeting among each other, et cetera. So it's not surprising necessarily to see some cases among students and athletes.
Thanks, Jane. We'll go back to Daniel Connolly.
Yes, so Dr. Randolph, the CDC put out some new guidance on testing. Could you remind us, what is Shelby County's current guidance on who should be tested? How does the CDC guidance affect that? And I had a follow-up.
Our current position as it relates to testing is still the same. And that is that, one, if you're having symptoms, you should be tested. Secondly, if you have been exposed to someone that has tested positive, you should be tested. And it's my understanding that the guidance from the CDC has been reversed to the point of saying, well, even if you've been exposed and you feel like you should be tested or want to be tested, you ought to. And so our position is still, it hadn't changed from that standpoint. The important thing, though, that people need to understand is that even though you are tested, that test simply tells you that at this time you are negative. You can still go and engage in some activity that expose you, that you can get infected. But the other thing about if you've been exposed, so you are a close contact, then you should be in quarantine, whether you are tested or not. And even if you are tested, you still may remain in quarantine for the 14 days because the incubation period for the virus is 14 days. And so a person could get exposed today, 2 days from now decide that I want to go get tested, that test is negative. That doesn't mean that they have not been infected. The test may well become positive 7 days from when they got it tested or later. So our position is that people who are direct close contacts to someone who's test positive must be in quarantine. That quarantine is a 14-day period. If they develop any symptoms or what have you, they should get tested, of course. If you have been exposed to someone that you know have tested positive and you're concerned, you should get tested.
Just real quick follow-up. Some people have raised questions about basically presidential administration influence on the recent CDC guidance on testing. How will the county make decisions on the CDC guidance going forward?
Well, I think a key thing that people need to pay attention to that they often overlook is CDC guidance. And if you read the fine print in a lot of the CDC guidance, it will tell you that this is guidance, this is not law, and that you should refer to your local, state, local health officials for their guidance. So we use the CDC guidance as well as other expertise for us to come up with what we think is the best approach for Shelby County citizens. And so that is why some of our requirements, safety measures may differ from what you see in other situations. Case in point, some have questioned why is it that Shelby County is requiring 12 feet separation in sporting events while other places are only 6 feet. Well, we know that there are studies that show that 6 feet may actually not even be far enough. And there are some studies that show that the virus can be projected 16 feet. One study, 26 feet away when someone speaks loud, cough, or sing. And so when we looked at the information and we gathered not just myself or the health department, but other medical experts as well as other stakeholders, politicians, officials, etc. And we decided that the best measure to protect our citizens and to allow some return to normalcy was to place the 12 feet requirement. Keep in mind that there are some places that are not allowing any gathering to sporting events. But we'll feel that we, given our data, our numbers, et cetera, that we could safely allow 12 feet separation. So that's just an example of how the county health directive safety measures may differ from what you see in other jurisdictions.
Alex Coleman, WREG. Alex Coleman, WREG. Okay, we'll move to Kendall Downing, WMC.
Hi, Dr. Randolph. I was wondering if you could explain for us.
Good afternoon.
Okay, we'll go back to Alex. Alex, go ahead with your question. Alex, I think you're muted on your end.
Okay, Dr. Randolph, can you hear me?
Yes.
Yes.
Okay, we were wondering regarding this, what's called this multi-system inflammatory syndrome in children.
We're having some kind of technical issues. We'll go back to Kendall Downing with WMC.
Hello. So, Dr. Randolph, I was wondering if you could tell us, with respect to the football teams, kind of the process that goes in place if you have, one team where cases are identified and they played another team. How does that work with respect to contact tracing and what happens there, knowing that all those players have come in contact with each other?
I'm going to let Mr. Sweat answer that because that falls under his division.
So good afternoon. Yes. So what we do with any case, whether it's in a football team or a workplace or just any individual at all, regardless of their age, is we first interview the individual, determine what are all the activities in which they've engaged, depending on, also look at the onset date of symptoms. If there are symptoms, if there are no symptoms, we look at the onset or at least the date of positive test result. We define an exposure period when they could be shedding the virus. We look into all the activities they were involved with all the people that they came across where they could have exposed others. And then we we reach out to all of those identified contacts. We inform them that they could be exposed and need to be in quarantine and discuss testing with them. And then we continue on with that. We have a team of contact tracer investigators, but we also have an epidemiologist on staff who focuses on outbreaks and cluster investigations. And so this situation, just like any other situation where there's a cluster involved, has been turned over to those investigators and that team for them to gather all the necessary information. And then those who need to be placed in quarantine will receive communication of their quarantine orders and also be given information about how to seek testing. So that's the process.
Kendall, did you have a follow-up?
Yeah, quickly. I was wondering if you could talk about, what would be considered a close contact on a football field? Are you necessarily a close contact because you're not a close contact just because you played a football game with someone that tested positive, but I guess hypothetically you could be a close contact if you played against an opposing player that tested positive. Explain the logistics of that for me.
Yeah, it gets really complicated, right? So the first the first sphere or first circle of exposure would obviously be teammates, coaches, and trainers on the same team with an individual who has tested positive, because they have the greatest number of interactions and the greatest amount of time, duration of time of exposure to the individual. As far as to the other, the opposing team, it's not that there's not an exposure there, but their exposure would be considered less just because the frequency of interaction and the duration of interaction with a person shedding is going to be less. But we would still inform that team about the potential. We would also discuss with them their opportunities for accessing testing and instructions about signs and symptoms to be observing for. But it kind of depends, right? It depends on your position. If you're a lineman directly across from another lineman and you're breathing in each other's faces and engaged in, over and over and over in a direct conflict, then obviously you're going to have more exposure than somebody who's subbing in for a play and is mostly on the bench on the other side. So there's no single answer to these questions, but we try to help think through what does the person do on the field, who have they interacted with, and then we go from there.
We'll go back to Alex Coleman with WREG.
Mr. Sweat, I was wondering, do we expect, with what you were just referencing regarding the student athletes, for some of these cases to really, really we show and see more cases of these when there's more contact with athletes? Do you anticipate more cases coming?
Well, this isn't the first disease in which there have been outbreaks among, athletic teams. So we've dealt with this before with MRSA, with methicillin-resistant Staph aureus, and other sorts of outbreaks that have occurred in sports teams. And what we see repeatedly is that most of the transmission actually occurs within the same team, among teammates and players that are constantly interacting, and among coaches and trainers that are interacting with the people on the same team. That's where most of the transmissions occur. Not to say it's impossible the other way, from team to team, but it is less likely.
Alex, did you have a follow-up?
No.
Go to Dominique Dillon, Fox 13.
Hello. When it comes to the spread of COVID, would you say even a month ago, are we safer now? And how much of a concern is it as far as social distancing and staying home and staying away from big crowds?
Right. So at the middle of July, we had our highest levels of activity for COVID transmission in Shelby County. We were having anywhere from 300 to 700 cases a day being reported to the health department. And we also were having a large number of people in the hospital. We actually peaked on July the 31st with the highest number of cases reported on a single day at over 646 cases. And then our highest date of hospitalization, or highest numbers in the hospital, was on August the 7th, with 365 people in the hospital. So we've come down quite a bit from those levels, and our testing positivity rate in mid-July was approaching, it was more than 16%, approaching 17% of all tests were coming back positive at that point. And now it's at 11.3% for overall positivity for last week. So we've improved on the numbers of cases, we've improved on our testing rates. So we do believe that the requirements for people to wear masks is probably the most single important intervention that was put in place at the beginning of July to drive these numbers down. And then also the closure of certain types of restaurants, curfew on bars, alcohol sales, and other restrictions that were put in place to limit the social interaction and just hanging out spots and people hanging out together and socializing in an unsafe manner. And that also has contributed to the improvements. So we're doing better than we were, but we still have, as I said today, we've reported 26,903 cases, but we have over 3,000 active cases right now. These are people that are diagnosed recently who are shedding COVID-19 virus. So we still have to practice social distancing. We still have to wear this face mask. We still have to limit gatherings. We still have to wash our hands. This virus is throughout our community, and it's still, if we were to abandon these practices that have helped us improve since the middle of July, it would not take any time at all that we would re-energize this epidemic, because there's plenty of virus in our community right now.
Thank you.
All right, we are out of time. Are there any closing messages?
No, just everybody, please stay the course, wash your hands, wear a mask, and protect those that you love and protect yourself. Thank you.
Thanks, everyone.